We welcome you back to our program, and as always, we're happy to have Dr. Gerayli back with us from Spinal Pain Medical Organization, and we thank you for joining us. You folks specialize in dealing with the spine, but all kinds of pain as well.
Good morning. Yes, we do, Rob, and we've been on the show several times before. We do specialize in pain management. A variety of pain syndromes are treated by the physicians and our other providers.
This is a specialty that I guess is relatively new. All doctors deal with some levels of discomfort, I guess, whatever it might be. But how did this get going, this subspecialty of pain management?
As you know, pain management has been around for hundreds of years, but like you said, most family practitioners can help their patients with very mild, basic pain issues that they may have. The area of pain management really became a true specialty over the past 20 years, and it has gained quite a bit of popularity over the past 10 years, I would say, where more physicians as well as patients have become aware that it's available to them.
Mm-hmm. Talk about the special training required to specialize in pain management.
Pain management was initially started under the field of anesthesiology. So in the early days, the anesthesiologists, who were very capable of doing a variety of injection-type treatments, started the field of pain management. Since then, a lot of other specialists, neurologists, physical medicine doctors, even psychiatrists are now doing pain management at varying degrees. But the training required is typically a fellowship that a physician does after he or she will complete a residency program in one of those fields.
Mm-hmm. So it's actually even more schooling and more training even beyond the traditional regular MD.
Correct. So a pain specialist, a board-certified pain specialist these days will have done training in a residency program that's after medical school training. They become board certified in that specialty. So, for example, it could be an anesthesiologist who's done 4 years of specialty training after medical school. Then that person will decide to go and do further training in pain management and get board certification in pain management.
And yet, for all of us, our doctors still seem younger and younger every year.
Isn't that true?
Even with all that schooling, it's interesting. So board certification is important. Is that something we should ask for? We should ask our doctor if we're dealing with a pain situation, are you board certified?
Absolutely. As a matter of fact, the state of California, the medical board, now requires physicians to disclose their training to their patients and specifically mention whether or not they're board certified and in which field. When it comes to pain management, there are a variety of providers who provide pain management services. This could be physical therapy facilities, our chiropractic colleagues provide pain management. But when it comes to interventional pain management, a specialist who truly is trained in providing interventional procedures, whether it's spinal injections or spinal diagnostics, whether it's implantable devices, whether it's large doses of narcotic medication management and so forth, you want to make sure, the patients want to make sure that that physician is board certified and accredited. And they can find that out online. American Board of Medical Specialties will list the names of physicians who are board certified in those fields.
We're not talking about that sore shoulder from playing too much tennis or picking up your grandkids over the weekend. We're talking about chronic, ongoing pain that somebody suffers, either caused by a major injury or a disease or something else.
That is correct. The basic mild acute pain that comes on after an injury or comes on because you have done something can be treated in most instances by your family practitioner. It is indeed the chronic pain that requires further investigation. It's the chronic pain that requires chronic management that really needs to be done by someone who's had special training in that field.
I think a lot of people have a fear of taking some type of narcotics because of potential for addiction. Obviously, dealing with a specialist, you're going to have somebody who's going to monitor that treatment and only administer what's needed to deal with the pain level.
It's not only the administration of the narcotic medication, it's the interaction that some of these pain medications can potentially have with other medications that most people are on. And nowadays, as the population gets older and older, chronic pain becomes an issue, and coexisting diseases such as high blood pressure, diabetes, heart disease, and so forth also play a role. So you have to make sure that the medications that are prescribed for other illnesses do not interfere with the medications that are prescribed for chronic pain.
Obviously, anytime somebody goes to see a new doctor, they're always given some paperwork to fill out, and one of the places on there is, please list your medications. That's very important for you if you're going to be administering, especially an injectable or even something someone takes orally. You need to know what else they're on so you can not have any interaction issues.
Absolutely, and it's another reason why it's so important to have a physician take care of that so that they are familiar with some of the interactions and some of the other medications that patients may be taking.
You touched briefly on it, but there's a range of modalities that you can use, everything from simple, even maybe over-the-counter type things, massage, heat, some of those things, up through injectables, up through implantable devices, and in some cases maybe even surgery. So you have a full menu, if you will, of ways to treat pain.
Absolutely. Pain management has really come a long way in the past 10, 20 years. And although you start with the most conservative treatments, and this could be very basic medications that are available over the counter with some basic exercises through physical therapy, there are modalities available that will range from injection procedures, diagnostic procedures, all the way to implantables and surgical interventions that you mentioned.
All right. Let's talk about the future. What do you see in the years ahead in the area of pain management? Where are you headed?
We see improvement. We see improvement in all aspects of pain management, as we have seen over the past decade. I think medications will become even better. We now have access to medications that minimize the side effects that were once not tolerable by patients. We see medications that are now timed release that provide patients with better pain control throughout the day. The techniques have improved, and now we are able to do diagnostic procedures and injectable procedures under direct X-ray guidance. There are some laser treatments that are now available. And minimally invasive procedures or minimally invasive surgery is the way of the future. As you know no longer have to open someone's abdominal cavity to take out their gallbladder. And as surgical techniques have improved significantly, that can also be used in various chronic pain conditions where you can, through minimally invasive procedures, take out small parts of a disc herniation that's impinging upon a nerve. Nowadays, some of our surgical colleagues even do minimally invasive lumbar fusions. So I think the future will go towards more minimally invasive procedures and much better medications.
All right, better results for everybody involved. It sounds like a really good future. Not that we want to be in pain, but if we do have it, it's good to know there's some good procedures to help us to feel better.
Absolutely.
That's great. Dr. Gerayli, as always, thank you for joining us. Good to have you on the program.
Thank you for having me.
Again, that's more information coming your way. If you want to give them a call, contact their office and get more. If you have specific issues or questions, they're happy to answer those for you as well. We'll be coming right back with more as our Monday program continues for you right here on Channel 6.